Cheshire Cosmetic. I'm the medical director here, and today we're going to be doing a short video a little bit about Botox. I'm going to tell you a bit about how it works, and we're going to do a live injection demonstration here with Natalie. So Natalie, before we go ahead, what kind of facial problems do you think you have?
I've got a deep wrinkle above that eyebrow.
Yeah.
Got two between my eyebrows.
Okay.
And I'm getting the start of crow's feet.
Sure, okay. Well, you're young and you've got great skin, so it is just the start of when you start to see wrinkles occurring. These are as a result of muscle contraction, so they're dynamic lines. They're only there because the muscle's moving. If we treat the muscles with Botox, what we're going to do is we're going to stretch the skin and give you better skin and certainly wrinkle reduction. And I would imagine that's going to last you a minimum of 3 months, maybe even a bit longer.
Great.
Okay, so for the purposes of today, what we're going to do is we're just going to look at the treatment areas, and I'm going to draw on Nat's face just to show exactly which areas we're treating and why we treat them as well. So if you perhaps want to have a lie back. So chin down at the touch, that's perfect. So if you can give me a deep frown. This muscle here, right in the centre, that's called procerus, and it's a thin muscle right in the middle which basically pulls the brow downwards. And if you can relax now, and then give me another deep angry frown. Very good. So we can see here the contraction in the skin that's causing this line and this line. So we'll be having another injection just here. This is a muscle called depressor supercilii. And again a deep frown, and another injection just there. If we can relax now. So let's have a look at the forehead now. So if you want to lift up your brow nice and high as you can, perfect. You can see there's some slight asymmetry here. So there's one line on the right forehead, but not the same line on this side. So we'll need to treat Natalie slightly asymmetrically. And it'll simply involve an injection just here. So lift up again and relax. Just one here. And again a big lift and relax. Good. So another one there is a prescription medication which is reconstituted to form a solution of a very precise concentration, and the type of syringes that we use enable us to inject a very specific dose into certain muscle groups. So I tend to use an exceptionally fine needle, and we couldn't really have a finer needle than this, because if we did, then you wouldn't be able to have a lumen, you wouldn't be able to push anything through there. So that's the needle that we use for this procedure, which you can see is very fine, and it won't hurt you a little bit. How do you feel about this?
Fine.
Okay, good. So we're just going to start by injecting centrally first, and that's going to be just here. So if we have a deep frown, thanks, and relax. Very good. So one just in the middle. And then I just tend to massage it slightly over the muscle, but I don't want patients massaging this because I don't want it to go into an area that it's not supposed to be. So again, another deep frown and relax. So we're just going to have one here. And again, another deep frown, perfect, and relax. Another one there. Very small doses, you can see that I'm not really plunging the syringe too much, because the amount of product that's required, particularly in a young patient like Natalie, is not too much at all. Another deep frown, thank you, and relax. You can see the contraction here, so we're just going to be injecting in this spot. And again another deep frown, thank you, and relax. So we're just going to be injecting just higher up. Now we talked about a little bit of asymmetry in Natalie's forehead here. So if you lift up your brow again, as high as you can, perfect. You can see that there's just a little line here, but not so much there. And that's because we're injecting, we've got a muscle which elevates the brow. It's working harder on the right than it is on the left. So it means that we just have to do a little bit of a higher dose on the right. And that goes just here. And we'll just do a tiny dose on the left. So again, a big lift and relax. Great. You might be thinking, well, why are we injecting so high up on the forehead? And it's because the evidence shows that the higher we inject in the forehead, then the more of a brow lift we tend to achieve. And actually, being able to achieve a brow lift in the upper face is quite desirable from a cosmetic point of view, so that's part of the reason for treatment. So once we've finished, we can just give Natalie a little clean here. And if we have a close look at her skin now, once we've injected it, we can see that there is no real trace of any kind of trauma. There's a couple of red little marks on the skin, but they'll be gone within about half an hour to an hour. There's no bruising, there's no swelling. So Natalie can now just go about her normal activities today. There's a couple of little bits of aftercare advice that we like to tell our patients. One would be, for example, I want you to do lots of facial exercises now, so I want you to frown a lot, lift your brow a lot, and big smiles for the next 6 hours. And that's really to try and activate the product. So we want as much Botox as possible to be available to interfere with the junction between the nerve and the muscle. So in other words, giving you a better result. There's some things that I don't want you to do though. So for example, I don't want you to touch and massage any of the injection sites yourself. Alcohol, aspirin, ibuprofen, try and keep them to a minimum today if possible. Also, are you having a workout? Are you doing anything physical today? Okay, so try and not do anything that's vigorously active. And posture as well. It's quite important to make sure that you're not increasing blood flow in the face. So for example, not bending all the way down, not lying completely flat, and then you should do absolutely fine. Okay. It's going to take around 3 to 5 days before the treatment starts to kick in, but really by 1 to 2 weeks that's going to give you a final result, and it should look absolutely great.
Thank you very much.
Okay. So that concludes our Botox session for today. I hope you enjoyed watching that, and hopefully it gave you some insight into how we do the treatment. If you need a free consultation with myself or any of the other staff here at Cheshire Cosmetic, then feel free to visit us online at www.cheshire-cosmetic.co.uk, or you can call 01606 544535. Thanks.